The governor is proposing a change in how Pennsylvanians can access health care. Under his plan, nurse practitioners in the Keystone State could practice independently. Now, here in Pennsylvania, nurse practitioners and physician's assistants have similarities and differences. Both work alongside physicians, both diagnose and treat patients, and both can prescribe medication. Nurse practitioners training is patient-focused. Between undergrad and graduate studies, it typically takes 6 to 8 years of schooling. Physician's assistants usually have about 6 to 7 years of schooling and have more disease-centered training. Newswatch 16's Adi Iyer has more.
A standing ovation for Governor Shapiro after he announced a policy at the 2025 budget proposal affecting nurse practitioners.
Like giving full practice authority to highly educated, highly qualified nurse practitioners who work under a licensed physician for at least 3 years.
It's a policy that's been debated for years, but Shapiro says it could help rural areas get access to much-needed health care.
In rural counties, there is one primary care doctor for every 522 residents.
Just a few hours after the budget proposal, the Pennsylvania Medical Society put out a statement saying they were disappointed in the governor's position and that patient safety is compromised when nurse practitioners practice without physician supervision. But one nurse practitioner in Lackawanna County says there's really no need for supervision.
I practice in primary care. I pretty much do everything that a family practice physician could do, but I'm a family practice nurse practitioner. There's not much difference.
In fact, when it comes to primary care, she says there's not really much supervision as it is. Nurse practitioners are registered nurses that have advanced education and clinic training.
There are no requirements for the physician to see my patients, practice in the same spot that I practice in, sign my charts, co-sign my prescriptions. The physician has no physical job per se, other than to put his name on a piece of paper and say that, yes, if I have a question, I can ask him.
27 states already allow nurse practitioners to practice without having to have a physician supervise them.
I used to practice in Port Jervis, New York, which is right over the border from Pennsylvania. I crossed the border into New York. I don't need a physician to collaborate with me. I walk back over the border into Pennsylvania. All of a sudden, I need a collaborative agreement with a physician.
She echoes Shapiro's point that rural areas need nurse practitioners.
It's unfortunate that more people don't get these services. So removing barriers to nurse practitioners to practice in primary care is key.
For the policy to be signed into law, it must pass in the state Senate and the House before Shapiro can sign the bill. Adi Iyer, Newswatch 16, Lackawanna County.